John Leslie with Feel Good Fitness. Today I am showing part of an overhead squat assessment with Britt. First thing I look at is the motion and stability of his foot and ankle. You'll see that the front of his foot lifts off the ground and he loses balance. He then performed an overhead squat with his heels slightly raised to identify if the loss of balance stemmed from inadequate dorsiflexion. With his heels raised, he was able to complete the movement with a stable lower body. We then tested the strength of his anterior tibialis, one of the muscles that aids in dorsiflexion, and uncovered a weakness. With these extra assessments, I'm confident that dorsiflexion is a legitimate weak point, and so we program flexibility of the calves and strengthening of the anterior tibialis. From the lateral position, when he lowers into a full depth squat, he displays a butt wink or posterior pelvic tilt. We also see that as he lowers down, his arms fall forward, but his spine and tibia angle relationship stay almost parallel. Good job there. He then performed a squat with his hands on his hips. In this variation, his spine tibia angle remained in good position and there was not a butt wink. So we conclude that his arms falling forward stem from weakness in the low back and not from the lumbopelvic hip complex. For this, we programmed strengthening of the low and mid back. From the anterior view, you can see that he has an asymmetrical weight shift to his left side. So I assessed his abductor complex, specifically the side where the shift occurred, and his adductor complex on the opposite side. We then programmed strengthening of the ipsilateral, same side, abductor complex, and the contralateral, opposite side, adductor complex. In a couple of weeks, we'll take another video and show improvements.